Hi, I'm Dr. Athré with Athré Facial Plastics in Houston, Texas. Happy New Year, January 2021. Today we're going to chit-chat a little bit about dermal fillers. Dermal fillers have been all the rage for the last several years. You've always heard about fillers probably in the cheek region. There's a lot of articles out on fillers in the nose, fillers in the lips. So here's the skinny on dermal fillers. First of all, dermal fillers are not new. Okay, the original dermal fillers were pure collagen. They actually made the collagen from the combs of roosters. That's the reason why those patients would need to be checked for egg allergy prior to injecting collagen, because in case you were allergic to egg, you would be allergic to the collagen. Over the last probably 10 to 12 years, fillers have come a long way. We no longer use animal products. Most fillers today are hyaluronic acid fillers. You've probably heard of Restylane, Juvederm, Voluma, Velour. All these are trade names, but in essence, all of these are hyaluronic acid filler agents. So what do? Well, a filler agent, you can think about fillers kind of like you think about Bondo on a car. So if you got a little door dings, you're going to take a little bit of Bondo to smooth over the door. Okay? Very similarly, we use filler agents to plump up the areas kind of like this line, or maybe a little volume under the eye. So what we actually do is inject an agent underneath the skin to add volume to that area. The most common category of filler agents are the hyaluronic acids. Now, these hyaluronic acids, you can think about it kind of like you think about hair gel. You've got control hair gel and hold hair gel. Similarly, we can take this hyaluronic acid and we can cross-link it, and there's various other chemical modifications that can be made to either make the agent thicker, thereby giving more support to tissues, make it thinner so that it can be a little bit more watery and can be injected in smaller areas. So depending on the actual filler agent, it's got different characteristics. There are two main manufacturers of filler agents. We have Galderma and Allergan. Galderma makes the Restylane products, and Allergan makes the Juvederm products. Dealer's choice. Get to pick whichever one you really like, or if you feel that there's specific agents that work better on you, doesn't really make much of a difference. Now let's talk about some of the thinner agents. Some of the thinner agents include Restylane and Volbella. So those are equal on both sides of that, on that seesaw, whether you're Galderma or an Allergan fan. The thinner agents are really good for thin areas, kind of like this area right in here, the under eye, just to give it a little bit of volume and a little bit of support. Fine lines right in the upper lip region or in the lower lip region. That's what the thinner agents are really good for. And by the way, this talk is just a real summary. There's a lot of special indications for these fillers, and this is why you really should see a practitioner who is really comfortable using these agents. Now, if you start moving along the line and you say, I really want more support in the cheek region or a fuller cheek, you really are looking for a fuller, thicker, stronger agent. Examples of this are Voluma, or a Restylane Lift, or a Restylane Define. These are all thicker agents that are going to give you more amount of the lift. One of the biggest questions I get asked is, how long do these agents last? The answer to that question is a little bit variable. First of all, it depends on where they're injected. For example, Restylane injected in the lips is going to last around 6 months. You take the same Restylane and inject it around the eyes, and you're probably going to get about anywhere from 10 to 12 months of longevity. The reason for that? We use our lips all the time. Those muscles are always moving, whether we're smiling, we're frowning, we're talking, we're kissing. We're doing all of these things, and that muscle tends to break down that filler agent. This area right in here is a more adynamic region, doesn't move as much. So those filler agents injected in that area tend to last a little bit longer. So quick rules of thumb. Lips, probably about 6 months. Under eye, probably looking in the 8 to 10 months range. Cheek, probably looking somewhere in about the 12 to 14 months range. So this is kind of a quick and dirty kind of, as long as the right product is selected for those areas, that's the kind of longevity that you can expect out of those anatomical areas. So who's a good candidate for these agents? First of all, someone who has mild to moderate facial aging, whether just a little bit of ptosis in this area, who wants a little bit of support. One of the most common things that I see is loss of volume in this area, and that could be caused by a couple of different things. One, it can be hereditary. You've probably seen Raquel here in the office, and she has a little bit of hereditary loss of volume here in the office. And then as we age also, we can tend to lose some of this fat pad, and that can cause that bone to be a little bit more prominent. So patients that have mild to moderate aging are great candidates for filler agents. You can get a great result with minimum effort, minimum downtime, and minimum cost. So this brings up a good point. So what's the downtime on these types of procedures? Procedures in my office that involve filler agents usually take approximately 15 to 30 minutes to do, and most of these patients can go back to work the same day. You may have a little bit of localized discomfort, whether maybe a little bit of redness in the area or a little bit of swelling, which can easily be covered up with makeup. I normally tell my patients, if they can, try to do the filler agent approximately 2 to 3 days before any major life events. So for example, if you've got a big meeting at work or something, try to wait at least 2 to 3 days prior to, so you've got a little bit of time prior to just jumping into that. If you've got a huge event like a wedding, try and schedule your filler probably about 2 to 3 weeks prior, so that gives you plenty of time to really get that maximum effect of that filler agent. Now, what are some of the special cases? I think of a couple of areas which is right in this region as a special case. And this is the second special case. So those two areas, for some reason, seem to be a little bit more immunologically sensitive. So the vascularity in this region is very vascular. You've got a lot of blood vessels, and they're all interconnected. For that reason, I really like to use primarily only Restylane in especially the glabellar region for a liquid rhinoplasty or in the under eye region. It seems to have the lowest complication profile of all the other agents. Last but not least, what are the complications of filler agents? Most patients experience a little bit of bruising, a little bit of swelling, and a slight amount of redness at the injection site, which all should subside within about 24 hours. Worst case scenario, some very, very, very rare reactions that can happen with filler agents. You can actually get the filler agent to occlude or block off a blood vessel, and if that occurs, you can have skin loss or even blindness. Both of those are extremely rare. However, this is another reason why you should only seek out licensed practitioners and providers for your filler agent. In sum, filler agents are a great complement to the facial aging routine. Gives you excellent results, low downtime, and can really be used to sculpt and enhance the beauty and target areas of the face. If you've got any questions about filler agents, about how to inject them, what types of injection methods, or simply what agent should be used, don't hesitate to give us a call. 281-557-3223, or look us up online, athrefacialplastics.com. Thank you very much.